Asthma. Asthma is a chronic inflammatory respiratory disease characterized by airway hyperresponsiveness and reversible bronchoconstriction. Inflammation and smooth muscle contraction lead to variable airflow obstruction, which presents with symptoms such as wheeze, breathlessness, and cough. Prevalence. More common in children than adults. In early childhood, boys are more frequently affected. In adulthood, women are more commonly affected. Occupational asthma accounts for around 9 to 15% of adult onset asthma cases. Symptoms: cough, wheeze, chest tightness, shortness of breath. Symptoms often follow a diurnal pattern, typically worse at night or in the early morning. Exacerbating factors include exercise, viral infections, cold air, allergens, and occupational exposure. Relieving factors include bronchodilators, avoiding triggers, and anti-inflammatory medications. In occupational asthma, symptoms often worsen during the working week and improve over weekends or holidays. Signs: polyphonic expiratory wheeze, tachypnea and dyspnea, use of accessory muscles in severe cases, and low oxygen saturations may be present in acute exacerbations. Diagnosis: there is no single diagnostic test for asthma. Diagnosis is based on clinical history, response to treatment, and supporting objective tests. Diagnostic criteria: recurrent and variable symptoms of wheeze, cough, breathlessness, and chest tightness. Personal or family history of atopy, for example, eczema, allergic rhinitis. Absence of an alternative diagnosis. Objective evidence of variable airflow obstruction. Investigations: FeNO testing in over 5 years old. This detects eosinophilic airway inflammation. Positive result: in adults aged 17 years or older, over or equal to 40 parts per billion. In children aged 5 to 16 years old, over or equal to 35 parts per billion. This may be falsely low in patients on inhaled corticosteroids. Spirometry. This is recommended for all symptomatic patients aged over 5 years old. FEV1 to FVC ratio is less than 70%. This suggests airflow obstruction. Normal spirometry when asymptomatic does not rule out asthma. Bronchodilator reversibility. This is positive if adults over 12% improvement in FEV1 and over 200 milliliter volume increase. Children over 12% improvement. FEV1 improvement over 400 milliliters is strongly supportive of asthma. Peak expiratory flow variability. A variability of over 20% over 2 to 4 weeks supports the diagnosis. Severity of asthma exacerbation. Asthma exacerbations are classified as moderate, severe, life-threatening, or near fatal based on clinical and physiological features. Peak expiratory flow rate, the percentage predicted or best in Moderate is 50 to 75%. In severe, this is 33 to 50%. In life-threatening, this is less than 33%. Speech in moderate asthma is normal. Speech in severe asthma, they cannot complete full sentences. Speech in life-threatening asthma, confusion, drowsiness, or coma. Respiratory rate in moderate asthma, less than 25 per minute. Respiratory rate in severe asthma, greater than or equal to 25 per minute. Respiratory rate in life-threatening asthma may have bradypnea. Pulse in moderate asthma, less than 110 beats per minute. Pulse in severe asthma, greater than or equal to 110 beats per minute. Pulse in life-threatening asthma, bradycardia, dysrhythmias, and hypotension. Oxygen saturations in moderate asthma, greater than or equal to 92%. Oxygen saturations in severe asthma, also greater than or equal to 92%. Oxygen saturations in life-threatening asthma, less than 92% with a normal PaCO2. Oxygen saturations in near-fatal asthma, less than 92% with a raised PaCO2. Additional signs: moderate asthma, no signs of severe distress. Additional signs in severe asthma: marked breathlessness and use of accessory muscles. Additional signs in life-threatening asthma: silent chest, cyanosis, and exhaustion. Additional signs in near-fatal asthma: requires mechanical ventilation. Further assessment: arterial blood gases, ABG. This is indicated if oxygen saturations are less than 92%, altered consciousness, or deteriorating clinical picture. Chest X-ray. This is not routinely required. Consider if suspected pneumothorax, life-threatening asthma, or failure to improve with treatment. Management: acute severe asthma. High-flow oxygen via a 15-liter non-rebreather mask if oxygen saturations are less than 94%. Bronchodilator, high-dose nebulized salbutamol. Corticosteroids, prednisolone 40 to 50 milligrams orally for at least 5 days or until full recovery. Ipratropium bromide, consider in severe or life-threatening cases or poor response to the salbutamol. This would also be nebulized. Magnesium sulfate IV, consider in severe or refractory cases. IV aminophylline and or mechanical ventilation, consider if unresponsive to the above measures. Chronic asthma management. Treatment is escalated stepwise based on symptom control and frequency. Short-acting beta agonist, SABA, for example salbutamol. This is a reliever inhaler used as needed for symptom relief. All asthma patients should be prescribed a SABA. Low-dose inhaled corticosteroids, ICS. This is preventer therapy, taken daily to reduce airway inflammation and prevent exacerbations. Add a long-acting beta agonist, LABA. For example, salmeterol. This is added if control is not achieved on ICS alone, i.e. inhaled corticosteroid. Continue inhaled corticosteroid alongside the long-acting beta agonist. Further steps based on response: increase inhaled corticosteroid dose, add leukotriene receptor antagonist, LTRA, and consider theophylline or oral corticosteroids under specialist advice. Discharge criteria following acute exacerbation. Stable on discharge medications for 12 to 24 hours, no oxygen or nebulizers required. expiratory flow rate over 75% of predicted or best, inhaler technique checked and documented, follow up arranged, typically within 48 hours of discharge. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today